in this region? Obviously, no, obviously. So the first question I'm asked myself if I'm in a country is where in my country am I reaching and how many people I am giving them the opportunity to get treatment? How many people that am I giving the opportunity to discover they have high blood pressure and they are at risk? So what we are calling this strategy improvement to access to care. It's access, improving access to care. That's the key word. Yes, here what we have to do is remember that people who don't know they have high blood pressure, which we call a diagnostic gap, is a demonstration of how much access the health system provides. If I say 50% of my population has no access to services, that's a very serious problem from the perspective of health equity. So if somebody does not have a diagnosis, it's a marker for lack of access to service. In the world, about 50% of people do not realize they're hypertensive. In Latin America, we're a bit better. The average is 70%. In other words, 3 of every 10 people does not know that they are hypertensive. But there's a lot of disparity. So we have some countries like Canada or Cuba that have more than 80%, but then others, Costa Rica, Chile, Barbados, have 70%. But we also have other countries where 30 or 20% know about people who are hypersensitive. In other words, they're leaving 8 or out of every 10 without a diagnosis. So the purpose of our Hearts program is to increase coverage. That is absolutely necessary to increase access, to find out who is hypertensive and provide timely treatment. So our goal here is that at least 80% people of hypertension in the community are diagnosed and receive adequate and continuous pharmacological treatment. And how are we going to measure that? Well, next slide. Well, this is to show you the cascade that I mentioned earlier, all in red, and you'll see your country there. You'll see which one's better or not. All the red is the prevalence of undiagnosed hypertension people, age standardized. And so, as I said, average is a pretty good one. One of the best regions in the Pan American Health in the World Health Organization. Our regional average is 70%, and almost all of our countries, 35 or 36, have more than 50% coverage. So this is the reason why we are going to raise our expectations. We're going to raise the quality standards, because if almost all of us have more than 50%, we need to make a bigger effort in screening, in timely detection, and in putting our patients into effective and optimal treatment. Esteban, let's stop here a minute. This is a shocking, is the purpose of this slide is to shock you, to alarm you, pinch yourself and say, I'm alive by mere coincidence, because the blue is saying, and I repeat this, the blue is showing you the levels of prevalence of diagnosis. In the red zone, I'm telling you the access to diagnosis in my region. If you told the politician in your country, well, how's the access for health coverage in my population, and you showed them this slide, what would happen? You shared this slide with them and took it to National Congress and showed them, look, this is those who have access to high blood pressure treatment in the country. They'd be shocked. So that's we have to do. We have to look at things head on, or we're not going to change them. If we can say, if we drop cardiovascular mortality, the biggest contribution we can make to increasing the life expectation in our country and decreasing disabilities, improving and decreasing healthcare expenses, improving quality of life of people. Because another problem we're seeing is life expectancy has increased, but healthy life expectancy has been left behind compared to the general life expectancy in the country. So if you look at this fact and look at where you stand, see where your country stands when you see universal access to health, look at what the access to care is. It's not enough to have a healthcare center where you say, oh, people can go whenever they feel like it. We'll give them medication, we'll provide free. What happens when people don't go? They don't go to the healthcare center. That's why the coverage of the healthcare centers must say, how are we going to increase access? And that's why the strategy is we have to encourage teamwork, because nobody can find this huge number of hypertensives. In the red side, there are already millions of people that are not diagnosed and untreated, working around the streets, and that don't know they have this condition. So let's move on to the next strategy. This strategy is to improve. Well, before 9 was to improve access. Now we're talking about improving the quality of care. Why are we talking about improving quality of care? It's 11. When we talk about quality of care, we're talking about control, as Esteban was saying. The diagnosis, that is the access to finding out if you're hypertensive and therefore increasing the possibility of receiving treatment, is a proxy from coverage and access to healthcare services. Now, control of blood pressure doesn't just mean dropping or decreasing blood pressure, because as we can see in an emergency room, they give a patient a medicine, they